Hi, Mr. Mehl. My name is Mallory. I'm the Nurse Practitioner student who's going to be doing your assessment today. Are you comfortable here in the room?
Yes.
Is it okay if I call you Tyler?
Yes.
All right, Tyler, I'm just going to wash my hands. All right, and Tyler, I'm just going to start by asking you some questions. What is your full name?
Tyler Joseph Mehl.
Where are you right now?
In the hospital.
And what city are you in?
Denver.
What time was your appointment today?
2 o'clock.
Can you tell me a past memory? Like, what was your favorite theme for a birthday party as a child?
Power Rangers.
Good, okay. I love them too. Can you count backwards from 7?
7, 6, 5, 4, 3, 2, 1.
Good, and can you spell world backwards?
D-L-R-O-W.
Okay, good. And so yeah, it looks like your hygiene, your dress, everything, your affect is all appropriate. So now I'm going to move on to the assessment of your skin. I'm just going to be looking for any suspicious moles or nevi, checking out your temperature, your capillary refill, your hair distribution. I don't see any edema at all. Capillary refill on your fingers. It's about 2 seconds. Can you see your back really quick? Just checking for any moles, any edema, scarring. All right, and nothing on your face there. Just gonna check out your skin turgor. Looks like you're nice and hydrated. All right, so now I'm just gonna start from up and work my way down. So I'm just gonna start by looking at your face, your head, your neck, checking for any asymmetry, any drooping, anything suspicious of possible strokes. I'm gonna go ahead, after checking you out, I'm just gonna feel your scalp for any masses or tenderness. And I'm gonna feel your TMJ. Can you open and close your mouth? Side to side with your jaw, forward and back. Good, no tenderness there?
No.
Okay, good. Any tenderness when I feel your sinuses here?
No.
Good. Shut your eyes really tight for me and don't let me pull up. Don't let me pull down. Good, okay. And now I'm just gonna feel your temporal arteries and your carotid arteries. All right, I'm just gonna listen to your temporal artery with the bell of my stethoscope. And your carotid. Hold your breath for me. Okay, you can breathe. All right, that all seems nice and normal. Can you go ahead and smile for me? Can you frown? Good. Wrinkle your forehead up and puff out your cheeks. Good, your cranial nerves are all intact. Can you raise your eyebrows? Can you shrug your shoulders? And tilt your head against my hand, not the other way. Perfect. All right, so now I'm gonna move on to the assessment of your eyes. I'm gonna check out your vision and make sure that everything is normal there. So it looks like your conjunctiva is nice and pink, your sclera is nice and white, no signs of jaundice at all. And it doesn't look like you have any asymmetry. And I'm just gonna palpate here, your lacrimal duct area. Any tenderness on your eyes at all?
No.
Okay. I'm gonna go ahead and check out your vision. So first what we're gonna do is have you hold this card 14 inches from your face. So sit up for me if you don't mind. So 14 inches is about right here. And what I want you to do is cover one eye and read the very bottom line, if you can.
4, 2, 8, 7, 3, 9.
Okay, and now let's do the same thing with the other eye. Read it backwards, that bottom line.
9, 3, 7, 8, 2, 4.
Perfect. It looks like you have 20/20 vision. And now I'm just going to look at your pupils and size them. Looks like they're about a 4. Actually, that one's a little bigger, which is interesting. That one's about a 5. And I'm just going to look into your eyes right here. Check your pupil reaction. And I'm going to see if they accommodate and that they both constrict when I go in like that. And let's check for your accommodation. Just look straight at the pen, follow it in. Good. And now I want to check your extraocular movement, so keep your head nice and straight and just follow my pen. pupils were equal or reactive to light, and that is perfectly normal. And now what I want you to do is tell me when you see my hands come forward, okay? We're going to check your peripheral vision.
No. 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 No.
Good. All right, and now Tyler, I'm going to turn down the lights and look at your retina. Okay. So I'm going to use my ophthalmoscope and set it to the 0 diopter. There we go, there's your red reflex. And I'm just going to come in close to your face. I see your fundus, your optic nerves, and I don't see any papilledema. That's a positive sign. And then your left eye, I'm going to hold the ophthalmoscope up to my left eye. Can you look a little bit more this way? Perfect. I see your red reflex. There's your optic disc, your nerves, and I see your vessels, and I don't see any papilledema there. So your eyes look nice and healthy. Okay, so now that I've done your eyes, I'll put the lights back on. There they are. And that one back on. All right, now I'm going to move on to your ears. I'm just going to look for any symmetry or asymmetry, which I don't see. They look nice and symmetrical. Any tenderness when I touch them?
No.
How about here with your tragus?
No.
Okay. And I'm just going to start by doing a series of tests to check your hearing. So I'm going to stand 2 feet behind you, and I want you to cover your ear and repeat the phrase that I'm saying.
1, 2, 3.
Okay, and I'm going to go over here and do it. 2 feet behind you, cover that ear. 1, 2, 3.
1, 2, 3.
Good. And now I'm going to do what we call the Weber test. I'm going to make this vibrate on top of your head. Let me know if you can hear it equally.
Yep.
Okay? And now I'm going to check your bone conduction and air conduction. Can you hear that?
Yes.
Tell me when it stops.
Stop.
Can you hear it now?
Yes.
Okay, and your air conduction should be greater than your bone conduction. That's a normal assessment finding. Now I'm going to look in your ear with an otoscope. I'm going to pull up and back and look at your tympanic membrane. Did you have tubes when you were a child?
Yes.
Okay. I don't see any bulging, no redness, and I see an area where it might be a little bit of a scar from a tube. All right, same over there, no bulging, no redness. Everything looks good in that exam. So now while I have this light out, I'm just going to take a look at your nose. It looks nice and symmetrical. Do you have any tenderness here
No.
on palpation? All right, I'm just going to look inside. Good, I see your turbinates. I don't see any polyps. It's nice and the appropriate color. All right, and what I want you to do now is close your eyes, and I'm going to occlude one of your nostrils. Tell me what you smell in the other one.
Alcohol.
Good. Do it one more time. Smell again. Do you smell that same thing?
Yes.
Okay. So you have nice patency in your nose, which is a good thing. Now, while I'm here, I'm going to feel all of your lymph nodes. So I'm just going to start here. Your pre and your post-auricular, your occipital, your tonsillar, submandibular, submental, your cervical, and your supraclavicular. Good, do they feel tender at all?
No.
Okay, perfect. And now I'm going to go ahead and put my gloves on and do your mouth. All right, can you just start by putting your tongue out and moving it side to side? Can you say ah?
Ah.
Okay. Let me just use this light again. All right, say ah again.
Ah.
All right, there's your tonsils, your hard, your soft palate. I'm just going to use this here. Your mucosa looks nice and pink. Your dentition, your gingiva, they all look really good. Say ah one more time. Good, and your hard and soft palate lift when you say ah. Alright, Tyler, now I'm going to move on to the assessment of your lungs. So if you don't mind, would you just pull this down for me? So first I'm just going to start by checking out the symmetry. It looks like your rate and depth of breathing is normal. I'm checking out your AP diameter. I don't see any barrel chest. That would tell me that you have COPD. Your rate and depth of breathing is nice and normal. So for now I'm just going to go ahead and palpate. Do you feel any tenderness on your ribs?
No.
Okay. And I'm going to go ahead and percuss. Good. And now I'm going to listen to your lung sounds. So just take nice deep breaths for me. Good, and now I want you to say EE as I listen.
E-E. 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 E-E.
Good, and now I want you to whisper 1, 2, 3. Great. And now I'm just going to have you say 99.
99. 99. 99. 99.
Good, and everything's nice and symmetrical. Now I'm going to go ahead and do the same thing on your back, so if you could just angle your feet off that way. And turn so the camera can see you. Perfect. Alright, again, I'm just looking at your symmetry. I look and see that your rate and depth of breathing is nice and normal. I'm just going to palpate your ribs. Do you have any tenderness?
No.
Okay. Do you have any tenderness when I bang right here?
No.
No tenderness?
No.
Okay, good. Now I want you to say 99 again.
99. 99. 99. 99.
Good, nice and equal. I'm going to listen again. Nice breaths. I'm trying to avoid your scapula. And I'm listening for it to be nice and equal on either side. Good, and now say EE.
E-E. 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 E-E.
And whisper 1, 2, 3. Good, and I couldn't hear you saying that, which is a good sign. And now, Tyler, I'm just going to feel for your diaphragmatic excursion. I'm going to start down here. Can you take a nice deep breath for me and hold it? And now let your breath out. Okay, you could breathe normally now. Your diaphragm looks to be nice and equal, lifting up your lungs in a nice equal fashion. Okay, now I'm going to have you lay back down and assess your heart. Alright, so I'm going to lay you down a bit. So first, I'm inspecting for any noticeable lifts, pulsations. Can you turn your head to the left? Just looking for any jugular venous distension, which I don't see. And turn this way. Good, I just see your carotid pulse, which is normal. Can you swallow for me really quick? Just checking out that trachea that I forgot before, and feeling for your thyroid. I don't feel any nodules or anything suspicious there in your neck. Okay, and now I'm going to feel your chest for any heaves or thrills. That'd be very similar to like a cat purring. And I don't feel anything as I touch your chest. And now I'm going to feel for your PMI. So I'm going to go mid-clavicular line to the 5th intercostal space. That would be about right here. Yep, there it is right there. So that's your PMI. And now, Tyler, I'm just going to listen to your lung sounds in 5 different areas. And I'm going to listen with the bell of my stethoscope to listen for any bruise. Good, I don't hear any bruise in that 30-degree angle position. I'm going to lay you completely flat now. And do the same thing. Good, I just hear a normal S1, S2, no clicking, no bruise. And now, Tyler, I'm just going to have you turn to your left a bit. Okay, and just rest your arm right here. I'm going to listen with you turning this way. So your aortic, pulmonic, Erb's point and tricuspid, and your mitral. And again with my bell. All right, great. And now I'm just going to take a listen with the bell on my stethoscope to your temporal arteries and your carotid. Hold your breath for me. Okay, you can breathe. I'm going to listen for your aorta, right above your umbilicus, your renal arteries, your iliac, and your femoral. Sorry, I have to kind of get down here. Okay, good. And now, Tyler, I'm going to move on to the assessment of your abdomen. I'm first just inspecting for symmetry. I don't see any masses, even hair distribution throughout, no edema, no bruising. And then I'm going to go ahead and listen to your bowel sounds in all 4 quadrants with the diaphragm on my stethoscope. Nice and loud. Good. Can you lift your head up? I just want to check for any herniation here, which I don't see. Okay. And I'm going to check for any friction rub over your liver and over your spleen. Okay. And now I'm just going to go ahead and percuss to listen for any tympany, which we should be hearing. I don't want to hear any dullness over your intestine. Nice and tympanic. And now I want to measure out your liver, starting here, up here at the midclavicular line. Just want to hear some dullness. So this is the border of your liver right down here. All right, and that should measure about 4 centimeters. With looking by my eye, it's about that, so that's normal. And I want to percuss over here for your spleen. Should be nice and dull as well. And your gastric bubble. Good, I don't notice any masses or any sounds where they shouldn't be. Now I'm just going to lightly palpate in all 4 quadrants. Any tenderness here?
No.
I'm just going to feel the border of your liver here. Make sure there's no enlargement. Same for your spleen. Checking for any enlargement, which I don't feel over here. Now I'm going to deeply palpate for any masses. I'm just going to put your head up a little bit so the camera can see a little bit better what I'm doing. I was just feeling all 4 quadrants deeply, feeling for any masses. And that feels normal to me. All right, so now I'm going to move on to your vascular system. I'm just going to feel all of your pulses, okay?
Okay.
So I'm going to start here with your brachial pulses, your radial, your popliteal, and while I'm here, I'm also going to feel for your popliteal lymph node, tibialis, and your dorsalis pedis. And again, over here, your popliteal lymph node, and your pulse, tibialis, and your dorsalis pedis. And the cap refill down here, also less than 2. Your hair distribution looks even, your temperature is even. Now I'm going to go ahead and move on to the assessment of your joints. So if you could sit up and dangle your feet here for me. All right. So now I just want to feel your joints for any crepitus, any tenderness.
No.
I don't see any edema or swelling. Everything looks nice and even. I'm just going to take a look at your back. Nice, symmetrical. Just going to palpate your spine. Don't notice any abnormal curvature, any tenderness here in your costovertebral muscles.
No.
Okay. And now I want you to do a few range of motions with me. So I want both of your arms to go up and put them back behind your head. Good. And put them 90-degree angle and put down like that. Any pain there?
No.
Okay, do it while I'm feeling you. Okay, good. And now for your elbows, I want you to just put your hands out like this and kind of twist like that. Good. Any pain there?
No.
Okay. Now put your arms back at that 90-degree and push on me. Pull on me. Arms straight up. Push. Pull. Good. And for your elbows, just bend your arms and pull and push. Good. And for your wrists, I just want you to see you point down, push against me, pull back. Good. No pain here.
No.
And put your fingers straight out. Don't let me pull them together. Good. Push your thumbs out like this. Hook. Pull back. Very good. Now I'm going to check out your hips. Okay, and for your hips, I first want you to just pull your leg to your stomach. Do you have any pain there?
No.
Okay. Any pain here?
No.
Here?
Nope.
I'm just going to bend and twist your hip a little. Good. And pull up with this one. Good. Pain?
No.
Any pain here?
Nope.
Push against me. Good. Push against me with this one. Now push against the other. Good. Okay. And for your knee, I want you to bend up. Kick out. Any pain there?
No.
Okay. And now don't let me push you down. Now don't. Yep. Same way. Bend. And push down. Pull up. Good. Now for your ankles, I want you to flex down. Flex back. Now push down on my hands. Pull back. Good job. All right, and all of your muscles, your joints, they seem to be intact. So now what I want to do is watch you walk. So I want you to go ahead and stand over there. You can put your gown on. Okay. So go ahead and just walk normally for me. I just want to assess your gait, your posture. Okay, go ahead and turn around. Now I want you to walk heel toe. All right, and now walking this way, walk on your tiptoes. Good, and now walk on your heels on the way back. and now what I want you to do is walk heel toe, heel toe. Okay, and now go back over there, and I want you to shut your eyes for 30 seconds, and I want to make sure that you don't sway. So close your eyes, feet together, and just stand for 30 seconds. And this is called the Romberg sign. All right, good. And now I'll have you sit back on the bed, Tyler. And we're gonna assess your neuro exam. So I'll have you sit up. And the first thing I'd like for you to do is to turn and have your legs dangle off the bed. And shut your eyes and play patty cake on yourself, on your legs, going back and forth really fast. Good. Now tap my feet, or tap my hands with your feet really fast. Good. Okay, now open your eyes, and I want you to touch your nose and then touch my finger, okay? Okay. Now with the other hand. Good. Will you just hold your hands out? I just want to assess for any tremors at all. Very, very slight tremors. Do you ever have a problem with that?
No.
Okay, maybe you just drank some caffeine. Okay, now Tyler, what I want you to do is close your eyes, and I'm going to place an object in your hands, and I want you to tell me what it is.
Penny.
Good. And how about the other hand?
Quarter.
Good. All right, and again with your eyes closed, I'm going to touch you with two different objects, and I want you to tell me if it's sharp or dull. So this will be sharp, and that will be dull, okay?
Okay. Dull. 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 Dull.
It's just checking your cranial nerves in your face.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Very good. You got them all right. And now I just want you to tell me what you feel on your fingertip.
Vibration.
Good. How about on your toe?
Same thing.
Very good. And now I'm just going to check your reflexes. So I just want you to relax. And I'm going to start with your brachial. Just relax your arm there. I'm going to hit my own thumb. And then your tricep. Here, we can just take this down. Actually, it might be a little easier if you're okay with that.
Yep.
Your brachioradialis. Okay. And again with your brachial. And your brachioradialis. Good. And I'm going to do your knees, so just close your eyes. Okay, and your Achilles. Good. And while I'm down here, can you just push down on my hand? I just want to assess your toes and make sure they're all strong. Push down on this one. Good. Any pain there?
No.
Okay. And I want to check your plantar reflex, so just go ahead and sit back for me. This is called a Lipinski sign. It might tickle your foot. Okay, sorry. All right, that's your Babinski. Now I did that. I think I've done just about everything for you. Did your Romberg. Oh, one more thing I want to do. I want you to close your eyes and tell me which way your toes, I'm pointing your toe.
Towards me. Towards you. Towards me. Towards you.
Okay. And I want to do one more thing. I want to palpate your bladder. I wanted to save this for last because I know it can be uncomfortable. It would normally be with my abdominal assessment. Any tenderness there?
No.
Okay, good. All right, do you have any questions, Tyler?
No.
Okay, thank you for your help.
Thank you.